For our first example of a hypothesis test, suppose a new drug is advertised as being 80% effective. A consumer advocacy group thinks that it isn't that effective and is looking for evidence it doesn't work that well. Assume a hypothesis test revealed a statistical p-value of 0.01. We need to find the null hypothesis, the alternative hypothesis, and make a decision based upon the evidence. So remember, the notation for the null hypothesis is H0, and the notation for the alternative hypothesis is HA. So now we need to figure out what the null and the alternative hypothesis are. The null hypothesis, remember, is the claim that we have no choice but to believe until we find evidence otherwise. That is the claim, the advertised claim, that the drug is 80% effective. So that would be P, the percent effectiveness, equals 80%. Remember, the null hypothesis always gets the equal sign. The alternative hypothesis is the research hypothesis. That's what we collect data and look for evidence for. The consumer advocacy group thinks that it isn't that effective and looks for evidence that it doesn't work that well. So the thing they're looking for evidence for is that the percent effective rate is less than 80%. So now we have our null and alternative hypothesis. They conducted a hypothesis test and found a p-value of 0.01. Notice that an alpha level is not stated in this little blurb. If not stated, assume alpha equals 0.05. Alpha equals 0.05 is a very common alpha level, similar to the fact that 95% confidence is a very popular confidence level. So now we get to compare our p-value to our alpha level. So capital P for p-value is 0.01, and our alpha value is 0.05. Our p of 0.01 is less than the alpha of 0.05. And remember, if the p is low, the null must go. P is less than alpha, so we're going to reject the null, find for the alternative. Now, in articles or news reports, the research hypothesis is typically the one being stated. It's assumed that the reader knows the null hypothesis is that there's nothing going on, the treatment doesn't work, no effect, everything is the same as it always was, the groups are the same, etc. See if you can pick the correct null and alternative from this real article. This is a Phase 2-3 European Pediatric Prevention Trial in a multi-center open-label randomized clinical trial to evaluate the prophylactic use of defibrotide in pediatric patients undergoing stem cell transplantation who are at high risk for hepatic veno-occlusive disease, which we're going to call VOD. In this two-armed trial, patients were randomly assigned to either receive defibrotide. Patients in the prophylaxis arm received 25 milligrams per kilogram per day of defibrotide in 4 divided doses beginning at the time of conditioning, and patients in the control arm did not receive defibrotide for VOD prophylactic measures. The primary endpoint of the study was development of VOD within 30 days post-stem cell transplantation, based on the modified Seattle criteria. The results from this clinical trial demonstrated a 40% reduction in incidence of VOD within 30 days after stem cell transplantation and achieved a statistical p-value of 0.0539. Now remember, the alternative hypothesis is the one that's stated in the article. That's the one the researchers were looking for evidence of. The null hypothesis is usually just assumed to be understood. So let's try to find the alternative hypothesis first. It says in the article that the results demonstrated a reduction in the incidence of VOD. So the thing that they were looking for evidence of was a reduction in veno-occlusive disorder. Now notice that they got a 40% reduction. That's just a sample statistic. That's exactly how much of a reduction they observed. When they compared that to the placebo, that's how they arrived at their p-value. Alright, so we have our alternative hypothesis. Now we need to figure out what the null is. Remember that the null is that nothing's going on. The two groups are the same. Veno-occlusive disease rates are the same in the prophylactic group, defibrotide group, as well as the placebo group. So the null hypothesis is that there's no change in VOD. Our final notes section for this chapter is longer than the typical final notes, but these are all extremely important. The first paragraph talks about if the null hypothesis was really true, the probability that you'd reject the null hypothesis is equal to alpha. So be careful when you're picking your alpha. You should pick your alpha to be the chance you're willing to take of rejecting the null hypothesis when it's really true. Recall that if we have a 95% confidence interval, we know that 95% of the future intervals are going to be telling the truth. They're going to contain the true parameter, and the other 5% are going to be wrong. Similarly, in our hypothesis test, alpha is the percent of times that you're going to be wrong in a hypothesis test by rejecting the null when it was really true. If the null hypothesis is the person did not commit murder, then you probably want a small alpha, because alpha is the probability you reject the null and say an innocent person is guilty. Alpha equals 0.05 would be a very bad in this case. If you're not sure which way to go, use alpha equals 0.05. The second paragraph talks about how it's important to pick alpha in advance. Otherwise, it's like cheating. If a drug company wanted to always say that their drug worked, and their p-value is 0.078, they could just set their alpha after the fact to be 0.08 so that their p is less than their alpha and they can reject the null and say that their drug works. So the alpha has to be set in advance if you need to make decisions with your p-value. The four main characteristics of a hypothesis test that we talked about are the null hypothesis, the alternative hypothesis, the p-value, and the level of significance. The null hypothesis is the status quo, and it always gets the equal sign. The alternative hypothesis is the experimental hypothesis. It's the one that you're looking for evidence of, and it has the less than, greater than, or not equal to sign if you have math symbols. The p-value is the probability of seeing a statistic at least as extreme as the one observed if the null hypothesis were true. Smaller the p-value, the more evidence you have against the null and for the alternative. In our VOD example, the p-value of 0.0539 means that there's a 5.39% chance we would see this much evidence against the null hypothesis, or this much evidence that the drug worked if it really didn't work. How do we determine whether that's a small enough chance to say that the drug worked? That's where the level of significance comes in. The level of significance is a pre-specified cutoff for how low your p-value needs to be in order to declare that you're going to reject your null and find for your alternative hypothesis. We reject the null hypothesis if the p-value is less than or equal to alpha. If the p is bigger than alpha, we're not necessarily saying that we know the null hypothesis is true. We just don't have enough evidence at that point to say that it's false. It's also important to talk about the fact that statistical significance is different from practical significance. Statistical significance is measured by comparing your p-value to your alpha. Determining that the result is actually important in a realistic setting is determining the practical significance of the result. In the defibrotide example, our p-value was 0.0539, and so by most standards that will be called not statistically significant as a result, because our p-value is pretty high. It's bigger than 0.05. But even if the results are not statistically significant, the fact that this defibrotide did see a 40% reduction in VOD to prevent blood clots indicates that it may still be practically significant, even if it wasn't statistically significant. So practical significance is different from statistical significance.